So prior to COVID-19, could you tell us what were the major prevailing mental health issues in your country of focus? And was the mental health infrastructure effective in managing these issues?
Thank you, Amita. In terms of mental health needs and resources in Pakistan, we are not much different from other middle income countries in the region. The prevalence for common mental disorders is also similar, which is expected to be around a lifetime prevalence of about 20%. What that means is that 1/5 of the population is likely to suffer from a common mental disorder at some point in life. Poverty, unemployment, literacy, and all this is contributing hugely to the burden of our health infrastructure. Pakistan has been engaged in a conflict with Afghanistan for 4 decades now, and at the moment has been hosting one of the largest refugee population in the world. The third factor, which I think is very important for the context of mental health needs, is the climate change. This has major implications in terms of how people have lost their habitat, the loss of livelihood, food insecurity, water insecurity, energy insecurity, and also a massive rural to urban migration. We already know that the prevalence of common mental disorders, they are likely to double in terms of prices. In terms of our mental health resources, they are very scarce with limited number of trained mental health professionals who are largely located in tertiary care hospitals based in urban sectors. At the district level, at best, we would have one qualified psychiatrist, and there are many districts with no trained psychiatrist at all. We do not have mental health integrated in primary care in Pakistan. As far as the legislation goes, we had mental health legislation enacted in 3 provinces, but there has been no systematic implementation so far.
The real issue has been the lack of any kind of access to services. If there's, that's been one of the biggest challenges in India in terms of mental health. So although at a policy level, we seem to have made a lot of improvements in the last few years. We've got a brand new mental health policy for the first time in 2014. We also got a new piece of legislation in 2017. The challenge has been actually in implementation. The challenge has been converting these policies and laws into something real on the ground. We have a huge treatment gap. The National Mental Health Survey, which was done in 2016, showed that the treatment gap for various conditions ranged anywhere from 60% to 85-90% in different parts of the country. In some parts of the country, we have reasonably good services, especially in the south, like Kerala and Tamil Nadu have extremely good services. But if you go north and east, for example, Bihar, Jharkhand, Uttar Pradesh, that's where the services are really, really lacking. And also the whole model of mental health services has been primarily a very biomedical model. So we've not really done enough work to address either the psychosocial drivers of it or even the psychosocial interventions for it. And finally, there are some very special groups which are completely forgotten in mental health in India. And these are like the elderly with mental health problems. We have a large population with dementias and other old age problems. And the other extreme age group which is forgotten is children. The problem has not been just a matter of money. We do have, the problem is everyone says we need more resources. Well, in India, very often, the budgetary allocations for mental health do not get utilized in the whole year. So, money goes back to the treasury because it is unused. And the reason that happens is because the mental health system's absorptive capacity is really a problem. So there are all of these supply side problems. There's, of course, demand side issues, but I think unless we solve the supply side issues, raising demand without addressing supply is always going to be a huge problem.
What has happened in Sri Lanka, I suppose it's the same in many other countries around the area in Southasia and so on. The legacy of the British medical system that they built up. So generally we were focused on severe mental illness, and they were being treated in institutionalized services. there were two big institutions in Sri Lanka and a few other outreach services, particularly in the urban areas. But subsequent developments, particularly after the tsunami, there's been a gradual spreading and peripheral development of mental health services. So generally, the services were available almost at a district level. All the district hospitals had a mental health, even in-ward and outpatient clinic, and that has been now even extended to peripheral areas. So there are outreach clinics and so on. So generally, I would say that Sri Lanka was fairly well managing the severe mental illnesses, meaning the psychosis, schizophrenia, and the bipolars, and so on. And to some extent, the management of alcohol and drug problems also were coming up, has been developing quite a bit. After during the COVID also, that became quite a big problem because of the sudden availability issue. Many of the drugs of abuse were not available and people went into withdrawal and there were quite bad reactions. But as far as the management of what Asma referred to as the common mental health disorders or the minor mental health disorders have been sadly neglected, and there has been not much development prior to the major disasters that Sri Lanka faced, the big war and then the tsunami. Subsequent to that, there has been some development of facilities and services to address these issues, but not enough and not in a broad way.